I'm Amanda Olson, and I'm a doctor of physical therapy, and I'm a certified pelvic rehabilitation specialist, and I'm also the president and chief clinical officer at Intimate Rose, and I am so happy today to be joined by Kristine, who is a certified sex coach, and we are just going to talk today a little bit about pelvic health and sexual health and some common issues that women and partners can experience that can affect their sex lives. So Kristine, do you want to talk a little bit about yourself?
Sure. My name is Kristine D'Angelo, and I'm a clinical sexologist and certified sex coach. I have a private practice in Portland, Oregon, where I specialize in coaching women and couples. I have been in practice for about 3 years now, but I've been doing sex coaching for about 15. I'm really excited to have this talk with you today because pelvic floor health comes up a lot in my practice. And I would love to just start, digging in.
Sounds great. Okay, so Kristine, on the clinical side, I am treating patients that are there because they have symptoms. So I am treating women and men, interestingly enough, that have pain or have urinary incontinence, and sometimes they are not there because of the pelvic floor dysfunction or because of the sexual health aspect, but it's a goal. You know, they are there because they have pain, and the pain is the primary reason. But their main concern, their main lifestyle issue is that they are unable to have sex, or maybe they're there with incontinence, but also they're unable to achieve orgasm, and that's really creating friction in their relationship, and also just a bummer to be missing out on that part of life. So for you, many women have difficulty actually achieving orgasm. So how do you advise women to help build up this skill?
Great question. It is something that comes up so often in my practice. For women, it's connecting their mind where sexual arousal begins, but also connecting them to their bodies. So many women kind of just ignore and disassociate themselves with that whole pelvic region of their bodies for societal reasons, right? It's like women are really conditioned from a young age to feel as though we can't talk about our bodies, that we're overly sexualized if we do, or, there's a lot of guilt around pleasuring ourselves, masturbation, and also just kind of an overall feeling of that a woman's body is somewhat dirty and that we shouldn't talk about it and we shouldn't look at it. And really often the only time a woman will pay attention to that part of her body is if something's wrong. And it's time to then start exploring and figuring out what's going on. So when a woman comes to me and says, I just really want to experience I think I might have, but I'm not really sure if it was an orgasm or not. We really go into more detail with her about what exactly did you experience? And a lot of it is learning about their bodies, learning about their sexual response cycle and how their body responds to arousal and desire, and what does that look like for them, and how can they recognize it and keep that energy flowing, which leads me into relaxation, being able to fully relax and allow yourself to be present in your body and really feel and connect with what's happening in that moment of masturbation or even experiencing sex with a partner. So one piece of the relaxation that I really work on with my clients is breathing techniques. Deep breath equals deep orgasm. So how are they breathing? Are they holding a lot of tension in their upper chest area? I ask them to take a deep breath for me, and usually I see a lot of this. Right? And it's not a proper way to take a deep belly breath. So you're actually not allowing your lungs to fill up with all of the beautiful oxygen that it needs to spread throughout your body. So by teaching them how to do these breathing techniques, it's bringing in that energy that they need. And it's also feeding right into that relaxation part. Another thing that usually gets in the way for women is self-applied pressure. Having this pressure of, I'm taking too long. Am I doing this right? There's an embarrassment around that. So oftentimes women will switch the focus from their own pleasure to their partner's pleasure, and it's no longer about them and what they want and need. So I teach them how to really find their sexual voice and to use it and to build that sexual confidence around, hey, some women take anywhere from 20 minutes to an hour to really warm up their bodies and be ready to experience an orgasm. And I don't think a lot of women know that. I think that they have this impression that there's insertion, and then all of a sudden you have this explosive orgasm. And it's like, yeah, because movies and media, and we're constantly fed that message, right? So just being able to let go and fully embrace their bodies, connect the mind and body, relax, breathe, and know that there's nothing wrong with you, right? I think that's where a lot of women get this block of, there's something wrong with me. And it starts to snowball. And that's really where women have a really hard time in the moment of being sexual with someone. There's a lot of noise happening in their heads, and that noise needs to quiet down, right? To allow them to really bring themselves into their body and breathe and recognize what's happening.
That is so in alignment with how I practice as well, breathing and connecting their mind to what their body is experiencing. I love everything you just said about that. And recognizing too that you can speak to this, the female sexual response cycle has like 5, if not 6 steps, and the male response is like 2 or 3. So we have unique physiological and emotional needs that are different from men. And so along those lines, so for women that are experiencing either pain with sex and they're being guided in managing that symptom, or difficulty with orgasm, how do you counsel these women to address the issue with their partner as they're working on this skill?
It's so hard for women who don't have a sexual voice. They don't have that sexual confidence to express themselves in that way, and to like, I want to say it, but I can't get it out, right? I can't use my voice to express that, whether they're afraid their partner is going to judge them. There's embarrassment around it. Women are not used to talking about their bodies, especially in a sexual way, and especially to their partners. It's just not how our society is built. But I do feel that it is moving in that direction, and it makes me so happy. So really what I do is I normalize the conversation. Like, the more sessions that I have with her, the more normalized this conversation becomes. And the next thing I know, I've seen her for 6 sessions, and she'll come in and she'll say, you'd be so proud of me. Like, last night I was at a dinner party and someone said vagina, and I actually corrected them and said, actually it's vulva. And I was like, oh my gosh. Like, and then she kind of is like, a few months ago, I never would have done that. So like, that's a huge step for someone to just say, hey, there's nothing wrong with talking about your body. This is your body. You own it. And there's nothing wrong with sharing with your partner what's going on. And if anything, your partner is going to be really grateful that you trusted them enough to talk about this, but it's also building intimacy.
Yes, absolutely. Absolutely, which can be so powerful for both people.
Yeah, absolutely. So it's really just about normalizing the conversation.
That's great. I love it. What is one mindset or maybe like a mantra tool or a saying that obviously recognizing that not one size fits all, but that you could give a woman struggling with the confidence to improve her sex life or to communicate with her partner, like you were talking about?
Oh, great question. I see this a lot. This comes up so often. Remember earlier when I was talking about how women just have a lot of noise in their heads and it's really blocking them from experiencing what's happening in their bodies. I teach them how to practice mindfulness. I think that that's a really important tool to learn and practice. Practice is the key to that, so that when you're in that moment and you're intimate with someone and you're having sex, you can utilize that as a tool to really calm down the noise in your head. So what I do is I usually start them off with a mindfulness daily practice. And I got this exercise out of the book, Sex Matters for Women. Are you familiar with that book?
I've heard it. I have not read it. It's on my list. I know
Oh.
that a lot of women are getting a lot of benefit from it.
Yeah, I mean, that and Come As You Are kind of my Bible. I refer to it a lot. Yeah.
I love the title.
So at the end of Sex Matters for Women, there's a whole section of exercises that you can utilize and use with clients, and it's so helpful. So this mindfulness exercise is in the back of that book, and it starts women off with just 5 minutes a day of meditation, basically, like really being calm, practicing the deep belly breaths that I teach them. But it also teaches the women how to bring in distraction and recognize it, and then being able to push it away. Because for women, we are so good at multitasking, and we wear so many hats throughout the day, whether it's being a mother, business owner, daughter, like wife, like all of these things. And we get so overwhelmed with tasks and things we should be doing and obligations. And a lot of times sex will turn into just another obligation for women. Like it does often feel like this is just one more chore I have to do today, right? So there's no more fun in that, right? You're just kind of like, So by being able to shut that down and recognize when distraction is entering your mind and having the ability to push it out and keep it out, right? And then you just start focusing on pleasure, and the next thing you know, a lot of amazing things happen, right? You feel amazing, you feel connected with your partner, you're experiencing orgasms, and you want to keep doing it because you're like, oh, wow, that was really fun and relaxing and beneficial. So
get more sex. Sex can.
Yes, having more sex, like wanting to do it more because it became fun and it no longer felt like a job, right? Yeah. So if women can do that 5 minutes a day, I will increase that every week by 1 minute, working up to 10 minutes a day. And by that time, you've practiced enough to where you feel like you can really utilize that as a tool in that moment when you're starting to feel overwhelmed with thoughts during sex.
I love it because 5 minutes feels doable. I think a lot of people almost can feel intimidated by being in their own head or being silent and hearing the thoughts in their head. And that's so manageable, 5 minutes, and then increasing by 1 minute. I think that that's a really great progression.
Thanks. I've really found it to be successful in helping women calm their minds and be present.
That's wonderful.
Yeah. All right.
Hearing.
Are you ready for your questions?
Yeah.
Okay. What does a typical pelvic floor exam look like? And what can a woman expect when going to see a pelvic floor therapist for the first time?
Sure. That is a question that everyone wonders before coming in the door, and depending on how they've been primed and who sent them or how they came upon this, they may be wondering, do physical therapists do that? Are they going to have me do push-ups? Or, in some cases, another provider, whether it's a physician or a urogynecologist that has a long-standing relationship with a pelvic PT will have spoken to the patient and warned them, and so that they know how to be prepared. But A pelvic floor physical therapy exam is very different from a PAP exam or from an exam that you would receive in a more medical. We are part of medicine. We are part of that world, but the examination that we're doing is very different. So when you first come to a pelvic PT, we are going to spend a significant amount of time talking about your medical history, but also talking about what your goals are, and what kind of functional activities in your life are being affected by what brought you there. So whether it's for urinary incontinence, pelvic organ prolapse, pelvic pain, inability to have sex, those are all different diagnoses that would bring a person in. And oftentimes, the conversation will bring up, oh, I have been constipated since I was 3, and so we figure out all these other things that help us create a more well-rounded picture about the person. And then oftentimes we'll screen their posture. So we're looking at the whole person, even though we are pelvic specialists. So people that do pelvic PT, oftentimes this is all we do. So that's all I've done for 10 years is just focus on that area, but we move that into the abdomen and include the hips and things. But we're going to look at the whole person, the posture, and then we'll do a brief vaginal exam where we are looking at the tone of the muscles. So in some cases, they're there because the pelvic floor muscles are too weak. And so they're having urinary incontinence or pelvic organ prolapse or inability to have an orgasm. So that muscle strength is part of that orgasm response. Sometimes too, the pelvic floor muscles are too tight. So we don't use a speculum. We only use our hands with gloves on. If you ever go to have an exam and somebody doesn't put gloves on, please turn around and leave. That's not part of our practice. But we're going to be looking at the coordination of the muscles. We're going to be looking at the strength and also the ability to relax the muscles in conjunction with what we're hearing is the problem that brought them there. And then we're going to devise a plan of care based off of those findings. So a plan of care, of treatment, could be 1 to 2 times a week, and it can range depending on the problem and how long it's been a problem, from 4 weeks to a couple of months. So oftentimes with pelvic pain, with intercourse, we are involving that mind-body aspect, and that plan of care can take a little bit longer because those things tend to take time to kind of unbury and unpack and get to the bottom of. But when you go to have a pelvic floor exam by a PT, wear comfortable clothing and just know that pelvic PTs are there to listen and find out how to better help you achieve that goal.
So it's not scary at all, right?
We're not scary. No, we're really nice people. I always tell people, I always like to use a spoonful of sugar. I always like to use like really clean 1950s humor. It's nobody's favorite part of their day. I mean, regardless of how comfortable, regardless of how many babies you've had, it's nobody's favorite part of their day. And I know that. So I always tell them, there's no speculum, there's no stirrups, it's just me, and I'm not on a mission. So if we need to stop, we're going to stop. And there are days where you may come for therapy and you're like, I don't want to be touched today. I'm just not in the mood. And that's okay. There's a million other things that we can do during that treatment to still be working towards that goal that doesn't always have to be quite so invasive. But doing the internal vaginal work is addressing the deeper layers of the pelvic floor muscles. And that's why it's so effective. But a lot of women that are experiencing pain on day 1 are not there yet. So it can take time.
Great information.
Yeah.
And you're so approachable too. I think if it was like the worst part of someone's day, at least they get to interact with you.
I will make it coffee hour.
So should all women be practicing and exercising their PC muscles?
Oh, yeah.
What is your approach to strengthening the pelvic floor, and what kind of equipment would you use for that?
So in the incidents where women have pain or they're having responses where they're having tightness of the muscles, they are not good candidates to do Kegels. So there was an old adage, and it was well intended, that said Kegels are for everyone, and I think they meant men can benefit from Kegels and all ages. But it's not true. So not everyone is a good candidate for Kegels. People that have urinary incontinence are generally good candidates for doing Kegels. Women that don't have pain but are very active, or women that have had children, they tend to have what we call an underactive pelvic floor, or a term that might be easier to understand is pelvic floor weakness. We try to stay away from that term, especially because of how it makes people feel, and it is possible to have urinary leakage and not have it be because of weakness. There can be other things happening, but in general, the people that are having pelvic organ prolapse, urinary incontinence, or inability to have an orgasm are good candidates for Kegels. There are a lot of different ways to do Kegels depending on what they're experiencing. For example, if somebody's having urinary incontinence, oftentimes it's the front fibers of the pelvic floor that are underactive or weak. So I would educate them to do a Kegel by imagining that the urethra is a telescope. So like a telescope long, and you're bringing it into the submarine. So you're pulling, it's a closure and drawing it into the body to get at the fibers right around the urethra. If they were having issues with orgasm, I might cue them to imagine a marble at the base of the vulva and pulling it up and into the vagina. So it's coming up and in, almost like those little animal claws that do this. And if they were experiencing fecal incontinence, or they were having flatulence and at embarrassing times, I would cue them to focus on the back fibers around the rectum. And so we would say to imagine that you are trying to prevent gas. And so one tool to use is vaginal weights. At Intimate Rose, we have a series of 6 progressive vaginal weights. Kristine, you have these too, right?
Yes.
They are
fantastic.
Oh, thank you. I'm partial, obviously. But the thing that we had in mind when we made them, so they're color coordinated where white is the lightest, and as the color purple gets darker, they get heavier, is that there's a place for everyone to start and progress to get stronger. So when you're imagining, the weight of the largest one, the purple one, when you imagine the weight of the organs that sit on the pelvic floor, we need to be able to withstand that kind of pressure. So being able to train the muscles to withstand that weight is likened to that. So after childbirth, there can be elongation, possibly tearing, possibly episiotomy. They can disrupt those fibers. So that's a tool to help restore strength. Some physical therapists use biofeedback, which is, there's several different types. It can be a device that has an electrode that would go into the vagina or into the rectum, or sometimes there's surface pads, and it hooks up to a screen, usually on a computer, and it allows the person to see what the muscle activity is like. So that's another tool that physical therapists often use in their practices.
Cool.
Yeah.
Thank you so much for that. I have some concerns when I do hear people, and especially, like Cosmo Magazine and these websites that are on Facebook, and they're like, everyone should be doing a Kegel. And it just, I'm sure that you can relate to that feeling of just like, it's not true. So I'm so glad that you said that. It needs to be said again and again and screamed from the mountaintops, right? Like, it's definitely something that I talk to women about right away, because they'll say like, oh, I'm doing my Kegels, and I'll talk to them a little bit more about that, and I'll say, how are you doing that, and they'll say, oh, I just stopped my stream of pee, like when I'm urinating, and I'm just like, whoa, okay, time out. Yes. That's not good for you. Stop doing that right now.
The American Urology Association is very prominent in their position on do not practice Kegels by shutting off that stream of urine. It's amazing how many physicians recommend that. I get them into my practice and they said, Dr. So-and-so said to do my Kegels while I'm urinating. No, it can tear and damage the pelvic floor.
Thank you so much for saying that. So what are the most common diagnosis or issues that you see in your clinic?
In my particular clinic, I see a lot of urinary incontinence and pelvic pain. It's really interesting amongst my colleagues. Again, a lot of people unfamiliar that physical therapists specialize in pelvic floor And then there are pelvic PTs that subspecialize in different diagnoses. We have clinics that only treat pelvic pain, and they're so good at it. And like, that is their focus, and they are doing tremendous work there. There are some that only treat women. There are some that treat men and women. Again, men can have pelvic floor dysfunction. But for me, I tend to see a variety. I live in, how would we describe Medford, Oregon? I live in a city that is surrounded by very rural areas, and I'm the biggest medical mecca between a 5-hour vicinity north and south. So I have some people driving 3 hours to see me after a cancer diagnosis. So I tend, because of my geographical location, I tend to see everything under the sun related to pelvic floor dysfunction, a lot of it being cancer. We do have an aging population, not that cancer is associated with aging, but just as a product of men having prostate cancer and women having ovarian cancer and things like that. I do tend to see that. But, in a more metropolitan area like Portland, Oregon, a clinician might still see all of those things, but you might have a clinic that only sees new moms. And so they, that's their specialty. They get moms back up and on their feet. They offer support groups and things like that. I have a colleague who specializes in men, in pelvic floor dysfunction in men, specifically pelvic pain. So, you get all of these different things, and we do, people have their mind blown of, oh, there's physical therapy for erectile dysfunction. Yeah, we can fix that.
Yeah, I think it's, in my practice too, I love, like, when I do the anatomy part of a session and I'm like, hey, you're about to get like adult sex ed right now. I love that look on the man's face if I'm seeing a couple and there's a man there, and I'm just like, and did you know you have a pelvic floor too? And he'll just be like, no, I had no idea. So when a man is in my office and we're doing the anatomy lesson, and I say, do you know you have a pelvic floor too? And they're really just surprised, and they're like, no, I had no idea. So I feel like, what you do and what I do, we're allowing like just a broader exposure to people with what the pelvic floor is and why it's important and how it plays a role in sexual health. And I was just saying, I kind of feel like we're superheroes in a way, right?
Yeah. Absolutely. I think that our clients and patients would agree, and it's not to be arrogant or braggy, but this part of a person's body, particularly of a woman's body, is just such a sensitive area, and it can really alter their life when they're having issues with it, and especially in a relationship, inability to have intercourse and to be intimate. For some couples, they are able to rally and it's not a problem, but for many it can cause such deep friction, because that's how they show their love, and that's how they communicate. And so to be able to get them back on their feet like you do with couples is amazing. I feel so honored when I have a partner come to a therapy session with my patient. It's very, very rare. And sometimes I'll get the partner coming in, and I think it's so beneficial for them to hear from a third party, what's happening and how to work together. So I think it's great.
I know. I think what you do is fantastic. Thank you so much for sharing your knowledge and your passion today. I think that this was going to be really beneficial for people, especially women who might not be aware of either of us existing, right?
Exactly.
So how can people find you and work with you?
So in terms of finding pelvic physical therapists, there are two big databases to look on. The first is the American Physical Therapy Association. If you go to PT Locator and enter in your zip code, you can find a PT in your area. The other is the Herman and Wallace Pelvic Institute. So if you go to hermanandwallacepelvicinstitute.com, they also have a pelvic PT locator. And then if you contact us at Intimate Rose, we have a list of clinicians, hundreds and hundreds of clinicians, sex therapists, women's health PTs, and we can also help you search by zip code to find a therapist in your area. So, it just kind of is helpful to get beyond that basic Google search, because if a therapist is in alignment with the APTA, the American Physical Therapy Association, or Herman and Wallace Pelvic Institute, it demonstrates that they've taken some coursework. And that's an important thing to ask. Not all dentists are created equal, not all veterinarians are created equal, and not all pelvic PTs are created equal. There is different levels of education. So sometimes it's helpful to say, do you treat my condition? Do you have experience with this, and how do you treat it? So for some patients coming in, because we all kind of tend to do some subspecialty, it can be helpful to get them on the phone and ask them that. And most pelvic PTs are not going to have a problem taking a phone call before an evaluation to talk to people. And if they do, find somebody else.
Move on to the next.
Yeah, exactly.
Great.
And how about you? How are you searchable?
Well, you can find me on my website, doyoursexlifeafavor.com. And the beautiful thing about what I do is you don't have to be in Portland to work with me. I offer in-person, phone, and Skype or Zoom sessions. So, I have clients in India, Canada, they're all around the world. So that's what I love about being able to, use this technology, and I can still help people. And then I offer a complimentary 20-minute phone session to talk about what the concerns are, if coaching is right for you, maybe sex therapy would be a better route. So we talk about that. And also I give you more information about me and the process of coaching. So the best way is just hop on my website and book that complimentary phone call. Or you can also follow me on Instagram. Sex Coach Kristine is my handle, and that's Kristine with a K.
Perfect. I love it. I know so many clinicians are going to be just so happy to see this, and especially considering your accessibility via technology, because sometimes, depending on where you live, there just aren't a lot of people with your skill set. So absolutely. I love it, Kristine. Thank you so much for your time. This has been amazing.
Oh, one more question for you.
Yes.
How can people find the Intimate Rose product?
Oh, absolutely. So the best way is to go onto our website at www.intimaterose.com. Interestingly enough, so I did show the weights here, the weights being for the urinary incontinence and things that we discussed. We are a very full line. I have been working together with our business partner for a very long time to develop these products of medical grade silicone. So on our website, you'll see the weights. Vaginal dilators for women that are experiencing pain that want to be practicing the mind-body exercises that you were discussing with use of a vaginal trainer. So those two things go together. It's not just about stretching tissue. It's not just about being able to tolerate something going into the body, but a great trainer, medical grade silicone. And our finish is different than any other medical grade silicone dilator on the market, because we have a smoother surface to it. And then we have the FDA water-based silicone on our website as well. And then, Kristine, you're gonna love this. This is a vulvar balm. Guess where it's made? My hometown, Portland, Oregon. It's organic, and it's for women that are experiencing vulvar dryness, so dryness around the opening of the vagina, in the soft tissue there from waxing or shaving or like cold weather, or that are going through changes associated with menopause or nursing. But it's like chapstick for the vulva.
Oh my gosh.
Yeah, it's all organic, and it was made actually in St. Helens, but close enough. We were really specific in looking for someone to help us make this that had all natural ingredients. So that's available on our website as well, and I'm really proud of it. I did use it as a diaper rash cream on my toddler, and I had a pelvic colleague tell me she used it as under eye cream, and it's amazing. So yes, lots of uses.
Yes. I love those multi-usage products.
Exactly.
Yes. I'm going to check that out. That's amazing.
Yes, I'm super excited about that. So all of those are available on our website, but we also offer support groups. And I've made about 50 or 60 different videos discussing different avenues of pelvic health and sexual health from the pelvic PT standpoint as well. So lots of resources there.
Great. Thank you so much for the work that you do.
Thank you for the work you do too, Kristine.
Thank
All
you.
right. Well, that will close it for today. And if you have any questions for Kristine, please don't hesitate to visit her website. And then I'm available at intimaterose.com or support at intimaterose.com as well. Bye, Kristine.
Bye. Thank you.